Okay, so we talked about PRP, or platelet-rich plasma. Now I want to take some time to talk about more of the cellular therapies, including some stem cell therapies. So stem cells, a buzz term. You hear a lot about this, fountain of youth, live to year 200. There are limitations to what we know and what we can do with stem cells, both from a regulatory standpoint, legally what we can do, but also from a scientific standpoint in terms of what these cells can produce in terms of a therapeutic outcome. But let's break it down into a couple segments here so it's easy to understand. The first product is called bone marrow concentrate. There are several depots for stem cell in your body. One of the easiest ones to access is your bone marrow cavity. So bone marrow is the tissue that's inside of all the bones, virtually all the bones in your body. And it's easy to get to that cavity in the back of your hip and pelvic region. So with a very simple procedure, usually takes about 10 or 12 minutes, can be done under local anesthesia or some light, what we call twilight anesthesia, where you're a little bit sleepy. We're able to basically do a fancy blood draw from the back of your hip, where it's rich in stem cells and other types of therapeutic cells. We collect them through a needle aspiration, okay? Then we take them to the lab and we concentrate those cells that research has shown have the greatest therapeutic value, including some of your stem cells. Now, it's important to note with bone marrow concentrate, it's not just stem cells. There are many other types of cells. And in bone marrow concentrate, there's also platelets. So in bone marrow concentrate treatment, we get the benefit of PRP because we concentrate your platelets, just like we do in PRP, but also the cells, including some of your stem cells, combine together to target a problem. We talked about how PRP works, namely through coordination of healing and through anti-inflammatory effects. Bone marrow concentrate in the cells in bone marrow perform a similar function, but a little bit more powerfully and a little bit more complex in nature. So with PRP, we tend to target very simple things, your itises, tendonitis, ligament injuries, tendon tears, acute injuries, things like that. With bone marrow concentrate, we tend to target more complex or chronic or difficult problems, like more advanced knee arthritis, for example, or a more severe tendon injury, or a more chronic scarred tendon injury, like a rotator cuff, for example. So we can kind of triage different problems to different biological therapies based on what we know from research, also based on what we know anecdotally from years and years of trying different things and learning as we go. So we talked about PRP, now we talked about bone marrow concentrate, and now we're going to talk about adipose-derived stem cells next.